What's going on, guys? Welcome back to the channel. In today's video, we're going to take a look at the medical aid or the medic within a Army Reserve unit, what a medic will do, their roles in an Army Reserve units, and the type of training that they're going to get. So let's get into it. Medical assistants are employed to assist and support medical officers and nursing officers to treat the sick and injured in CAF units and on operations. A med aid has the following primary duties: provide initial care for patients, provide basic life support treatments in trauma cases, health assessments to include perform electrocardiograms, conduct hearing and vision tests, assist with immunizations, collect specimens, and perform basic laboratory procedures. They perform specific environmental health and preventive medicine duties, initiate, maintain, and distribute medical records, documents, reports, and returns, provide medical support on weapons ranges and during training exercises, operate and maintain medical and life support equipment, maintain, replenish, and account for general and medical supplies, and conduct first aid, medical, and military training. They primarily work and train with their unit in order to provide support to the reserve force and augment the regular force as required. When on exercise and deployed in operations, med aids are exposed to the same discomforts, threats, and risks as the forces they support. As a med aid, you're going to be expected to work long hours in physically demanding scenarios. So that was just a quick overview of the aid, what a medical aid will be trained to handle and be able to do. As a med aid, you're going to be doing a lot of training. Primarily, you're going to be learning a lot of things at your unit, but you'll be employed in the field. It's primarily in the reserves, or we usually have medics or med aids, as they like to be called, whenever we're doing live demolition or live fire. So if we're doing a live demolition range, we have the minimum of 2 medics on site when we're doing our training. If we are doing live section, platoon to company size, and that goes for any of the units, you're going to have probably 2 to 3 medics on site. Basically, the med aid on site when we're doing live training is to be able to react and take care of any type of injury that happens during training. So a med aid will do anything from just a cut, putting on a band-aid, all the way to an amputation or a severe injury. Medics are there. They're going to react quickly. They're going to treat the casualty, get the casualty onto an ambulance and off to the field hospital or to the civilian hospitals. So medics are highly regarded within the combat arms because we need them to be able to take care of our injured and our wounded, get them to safety, and treat them on the battlefield if needed. So I was able to get hold of a medic who was ex-Reg Force, is now in the reserves, and that medic gave me a lot of information. So what I'm going to do is I'm just going to read it out to you guys. What you're gonna learn, how long you're training, and the types of opportunities you're gonna get as a med aid to deploy overseas. So I asked the medic some simple questions, and this is the response I got. The first question was, what is the difference between a med aid and a med tech? The medical assistant is similar skills as a med tech. They are unable to obtain a QL5 type qualification, basically with limited international deployment opportunities, but there's lots of opportunities for domestic deployments. The medical technician, which is primarily a Reg Force role, but a reserve can become a medical technician. What they need is to be a qualified paramedic in the province they reside to become a medical technician. If they don't have those types of qualifications plus other skills, then someone who's interested in that position will have to go to become a med aid first, and then I'll gradually move on to become a medical technician. But the main thing they're looking for to become a med tech is you must be a qualified paramedic within your province. So the medical technician is qualified as a primary care medic With Advanced Emergency Medical Care Assistant, they require a certification of exam. There's lots of deployment opportunities as a med tech, and they have the ability to work independently. So they don't have to work within a team, but a med tech can work independently. Second question, how long is the length of the training to become a medic? So you need to do your BMQ land. Right now, I believe medics don't have to do BMQ land anymore. You will do your QL3, which is your qualification level 3, and that's about 5 weeks long. And this is general, from first aid to casualty care and so forth. And then you do your QL4, which is 4 weeks, which is more things added on to make you a fully qualified med aid. For the medical technician, your QL3 is 3 months long, and this is both regular force and reserves. Okay, your primary care is about 6 months long, and your QL3 field portion, which you're out in the field doing training, is 1.5 months long. Your QL5, which is another level up that medical technicians need to get to, it's 4 months long full-time. So a lot of the courses are going to be full-time during the summer, and there's really no part-time medical course because of the length of the course and all the skill sets that you need to acquire. Third question I asked, what happens after completion of your trades courses, right? So if you are in the reserves, you're going to go back to your unit. You're going to do your 1 night a week, 1 week in a month, and you're going to be doing your unit's weekend exercise. You may be called upon to be on-point medics for other units, whether they're doing dry training or they're doing live type training. The fourth question I asked, what are the specific courses available for trades? So from that medic, they said there's so many different types of courses you can take. Anything from driver wheel, forward, aero medical specialist, which is about a week long, the aero medical crew course, which is 2 months long. You can apply to the Canadian Medical Emergency Response Teams, which is a 2 to 3 year commitment. And this is basically primarily for Reg Force. Reservists, yes, as a reservist, you probably may be able to get onto that, but it's a lot of training that you're going to have to do. Okay, and you have your EMR instructor, which is basically someone's qualified to teach emergency medical response. The fifth question I asked them was, how often does a medical reservist attend Reg Force exercises? And it depends. Primarily, Reserve Force medics will get opportunities to attend the large-scale exercises that the regular force do, whether it's rotational exercises or pre-deployment type training. Reserve Force medics will get that opportunity to attend those exercises, participate in those exercises, and gain valuable skills. Questions 7, skip that one. How often can a medic get the opportunity to deploy overseas? Okay, and it, from their point of view, it depends on operational requirements. So if a unit is deploying overseas and they require medics or medical techs and doctors, it's a good opportunity for the medical aid and the medical technician who are reservists to get that opportunity to deploy overseas and to utilize the skills that they've gained here and use it while they're deployed overseas. Question 8, do you need a medical background to join? Absolutely not. You do not require a medical background to join the Army Reserves medical units. So before in the past, it used to be like that. Now it's like basically you do not need any type of medical qualifications. Number 9, how often do medics attend other units training? As I said before, whenever that unit required medics, primarily for live fire or live demolition type training. This question I asked, and I'm sure a lot of you are probably wondering, what's in a med aid's bag? So their response, so many things. Supplies for airway, breathing, and circulation will be relatively handy in the med bags. Multitude of life-saving medications, pain management, and OCTs. Lots of bandages, splints, and tape. Each medic bag has a defined kit list. However, each medic sets theirs a bit differently. So within the medic bag, it depends on how the medic wants to pack his or her bag. Now, there is a kit list which is standard for all medical bags, but as a med aid or med tech, you can add or take away certain types of kit that you do not require. One of the things that I did ask the medic is, as a Army Reserve med aid, what are the opportunities to get different types of training in the civilian world? And responded by saying there's more opportunities as a reserve med aid to get onto lots of civilian medical courses, whether it's from nursing to cardiology, anything like that a Army Reserve med aid can go on to and gain further skills. The difference is, as an Army Reserve medic, you're going to gain more valuable skills going on to civilian course than a regular force member, because their skill sets are set one way. Yes, they may get opportunities to go on work in hospitals, but as a reserve medic med aid, you're going to get opportunities to gather a lot of civilian type qualifications, which is going to make you a better soldier and a better medic. So that's some of the questions that I did ask that medic. I want to thank her for the opportunity to speak with her so she can give me a lot of insight. It's a lot of stuff for me to remember, so that's why I kind of read it to you guys and we talked about it a bit. But from working with medics, I really appreciate the work they do. They do work hard, especially during the COVID-19 pandemic. I did work with a lot of medics who were invaluable to the operations that we did. So there it is, guys. Just a quick overview and about the med aid and the type of training that you can do as a med aid and also as a med tech. I hope it was informative, especially for those who have been contacting me and asking me to do a video about the med aid. I hope the information that I'm giving you is valuable and it gives you an idea what type of training a med aid will be doing and is required. So I hope you guys like this video. Give me that big thumbs up if you like it. If you're new to this channel, welcome. Please do subscribe. Please hit that like button. Give me that thumbs up. If you have comments, please post it in the comment section. You guys can also reach out to me on Instagram if you have reserve force questions, primarily of joining the Army Reserves. Like, you can post those questions. I really appreciate all the people who've reached out to me on Instagram, and hopefully I've been able to respond to a lot of your questions. So there it is, guys. Thank you very much for joining me, and I'll catch you in the next video.